As you will well be aware, which is nothing to do with SNOMED, but just in terms of clinical practice changes at quite a rapid rate. New drugs come out, new treatments, things that we used to do to patients in years gone by, we don't do anymore because we've learned better. So the real drive for clinical engagement is this thing in yellow in the center of the screen, to make sure that SNOMED is enhanced by clinicians to support current and future clinical practice. So one, we're aiming to have clinically assured content. So it's not just we'll add stuff to SNOMED and we model it in SNOMED. We also want to make sure that it's clinically relevant. The issue around clinical input into future developments, one of the challenges that we have with changing clinical practice is that once practice changes, clinicians are looking to record that information now. What they don't want to do is put a request in either through the National Release Centre here in Paris or through us directly. And even though we're on monthly releases, there's still a time lag. So we're looking really to work with clinicians to get information ahead of time, if you like, so we can make sure the concepts are in there ready to use when they need to be used, which is where the timely responses to clinical advances come in. As well as content going into SNOMED, one of the things we also do is look at what we refer to as derivative products. So they might be value sets, they might be subsets, they might be maps, but there are a number of them that are driven by clinical use cases, which we look to develop and support. Clinicians are special, and I say that as an ex-nurse, so I can get away with it in some ways. But in terms of, we look at developing educational materials, particularly with clinicians in mind, either in terms of the focus of the materials, so it might be around clinical use cases, for example, or in sometimes is more about the length of the educational materials. So what you don't want if you're a clinician is to sit there looking at a 3-hour webinar, because you don't have time to do that in your day-to-day work. We also look there around implementation support, which is where Kai and Anne and their colleague Alejandro come in. So look at really what clinicians need in terms of support with SNOMED going into either into EHR systems or looking at processes supported by EHR systems. The whole idea is that we try to drive this and redevelop a corporate culture within SNOMED International that clinicians are important, I guess. To do that, we have a number of different ways of doing it. We've set up a series of clinical reference groups, which I'll talk about in a moment. We have project groups and we have editorial groups. Within, that's at SNOMED International level, if you like. Within the members themselves, quite a lot of members have their own clinical engagement activities, all of which vary from country to country, both in terms of focus, but also in terms of their experience, I guess, and length of time they've been with SNOMED. So some are more mature than others. The focus can also be between countries. So there might be joint projects related to content or joint projects related to implementation. If you're interested, then, you know, as I put in here, go through your National Release Centre. I put in SNOMED.org members, but I know that Mail and Elizabeth's slide deck have got their the French NRC's contact details. So first of all, with clinical reference groups. So clinical reference groups, the idea behind it is that out there you've got clinical communities with all different types of clinicians, and all of them have their own unique requirements, if you like, and those requirements feed into clinical reference groups. Those are reviewed, we work with the authoring team, and that content goes into SNOMED CT, into the international release, if you're talking about the SNOMED International and clinical engagement. That then, obviously, once it's in the release, then becomes available to those clinical communities that request it in the first place. The same level as clinical reference groups, we've got editorial groups and project groups, and I'll talk about those in a minute. And yeah, we have to have, because we've got multiple groups involved, we've also got a clinical coordination function, which I lead with a couple of my colleagues. So what's a clinical reference group? Well, a clinical reference group is literally a group focused on one clinical specialty area. The reason why we do it is to enable topic-based discussions between clinicians. So particularly if you're looking at what's in use currently in a particular clinical specialty area or what's coming, however good they may think they are, one clinician won't have all the answers. You need to work really with the group because different clinicians will bring in different perspectives. The groups themselves provide a platform really to discuss issues, discuss experiences, particularly where it relates to implementation. So, things like, I've been using a SNOMED system. I wanted to record this particular diagnosis and it wasn't there. What do you do? For each of the groups, we have a dedicated website. Well, we have a dedicated conference. We don't use website, we use conference pages. All the conference pages themselves are open and transparent. I'll give you the links in a minute. So any of you can go and look at the pages. You can read what's on there. They're open, obviously, to clinicians who are interested in the specialty, but they're open to anybody else. So we don't restrict access in terms of who can look at them. In terms of the project groups and the editorial groups, they're different in the sense that all of those are task and finish groups. So we set them up for a reason. They fulfill their reason for being, and then we stop them. Clinical reference groups, we literally keep going forever is a long time, but certainly for a longer period of time. I won't say forever. And then one of the things, one of my colleagues up on the bottom here, so we all have experiences and we can all learn from each other, which is really what drives the discussions within clinical reference groups. So hang on, all these up. It's my colleagues go mad with animation. So what's the expectation? Well, one, they facilitate multidisciplinary topic discussion. So as well as having discussions within the specialties, we also try to get a number of the groups where there are common issues to actually have discussions between groups as well as within groups, which allows them essentially to access expertise from any of the clinical domains. In terms of us, so in terms of SNOMED International, all the requirements and all the drive to have the groups, it has to have an international focus. It doesn't mean that we ignore the national issues. It just means that we pass the national issues on to the national release centres. So really what we're aiming to do is make changes and make things accessible via the international release. So they need to be applicable essentially in every member country. It allows for different levels of engagement. So we have face-to-face meetings, we have discussion pages, we have virtual meetings. So it helps you use different approaches. Because of the discussions we have, one of the things that you find is the bottom one here, the early identification of global changes to healthcare. So clinicians know what's coming through, either because they've been keeping up to date with research, or there are drivers nationally where they're highlighting new treatments for either safety or cost reasons normally. I've put on some we've got here. The list, as you'll see, is growing. The one thing to say about more about CRGs actually rather than project groups, we don't aim to have clinical reference groups for every single specialty. So the WHO did a whatever you want to call it, a standardized list of all the clinical specialties. The list has 307, we did last time I looked, had 378 different specialties. We're not aiming to have 378 clinical reference groups. mainly because they're quite, there's a lot of administrative overhead to get them going. We'll get them going and keep them going, which is more to the point. So at the moment, the clinical reference groups we have are around allergies, around anesthesia, dentistry, the genomics and precision medicine one. We're looking at what we're doing with that one, and the same with general practice and family practice. Then mental and behavioural health, nursing and pathology and laboratory medicine. And we've got project groups at the moment focusing on cancer synoptic reporting. Diabetes is on hold because we've made some changes. We're just waiting for some additional changes to come through. Epilepsy has almost completed its task. And the nutrition care process terminology group has actually finished their work and has now transformed into a clinical reference group. So we've got the whole nutrition side of content, if you like, will continue, but will continue as a clinical reference group. If you work with them, so this is just a page from the anesthesia one. It could be a page from any of them. As I said, they're hosted on Confluence. If you look on the top of a Confluence page, any of these groups will have the same thing. Well, if you're logged into Confluence anyway, you'll have edit, you'll have save for later, but the important bit here, there's a tab called watching. And if you click on it, you'll get this pop-up box which says, do you want to watch just this page that you're looking at? Do you want to watch all the content in the space? Or do you just want to watch the descendants? So if you tick the one that I've ticked here, which is watch all the content in this space, assuming that you're on the landing page here, which is this one's for anesthesia, what it will do, if any changes are made to any of those pages that are below that, the child pages, the way they're set up, you will get an email notification saying there's a change. Do you want to go and have a look? If it's an area that's of interest to you, it's a handy way of keeping up to date without you keep going into the pages every, well, not every day is a stretch, but every week or every month. It's just a way of automatically keeping up to date. And quite a lot of people use it. It's proved very effective. So what they work on, so just to give you some examples, the dentistry group are working on the odontogram. If you don't know what an odontogram is, when you go to the dentist and they open up your mouth and go, 1 has a gap, 2 has a something, 3's missing, that's the odontogram. They're also working on periodontal content, so not just the teeth, but looking at the gums, your palate, and the whole thing within your mouth, essentially. The nursing CRG, they've completed this. They're now looking further afield at other nursing classifications, but their focus was on the international classification for nursing practice. They're now looking at a couple of other nursing classifications with us, with SNOMED International, because we're looking at collaboration agreements with them, which are, if you have a nursing background, they're NIC, NOC and NANDA. So the nursing interventions classification, the nursing outcomes classification, and the North American nursing diagnosis and something that I can't remember what the A stands for. The nutrition care process terminology does what it says on the box, essentially. What they're doing is looking at taking the nutrition care process terminology and incorporating that into SNOMED in terms of new concepts going in. The anesthesia group have an ongoing love-hate relationship in some ways with ISO and with some of the international standards relating to anesthesia, which means that there's quite a lot of focus, one, about keeping up to date with global changes in anesthesia, but also looking at how we incorporate some of the assessment scales, particularly those which are used pre-theatre, so pre-anesthesia in theatre. Where are we going? So this isn't a constrained list, but there's a couple of areas that we're actively looking at. One is emergency medicine. There's one around neurology, so neurology and neurosurgery. One, like I say, one around nutrition and dietetics. So whether we look at where the nutrition care pathway has gone and extend it further. The two of the ones which aren't on this list, which we're looking at, one is to do something around public health, and I don't know what that will be yet. And the other one is looking at some kind of general surgery group. And we're looking at it. I'm not sure how the surgery one would work. So it's like the scope would need to be a lot broader than normal clinical reference group. So that one's under consideration by me and my colleague, trying to work out how we get it to work, essentially. What else do we do? Well, I've been very bad of late, so I haven't arranged any of these, but we do clinical webinars. We have and I'll come onto this in the next slide deck. So we do clinical webinars. We also do some implementation webinars, and I'll run through where those are and how to access them in a minute. In terms of conference sessions, so we as an organisation have essentially two conferences a year. One is in literally 2 weeks' time. So we usually have one in April and then one in October. The one in October is more of an expo. So we bring in a lot more vendors. There's a lot more participation and feedback from real SNOMED implementations, if you like. Just a one-off this year. In May, we're running a SNOMED in Europe conference in Brussels. And I'll give the details to Mal and Elizabeth so they can email you all the details. We're running the conference in Brussels, but we're running it as a hybrid event. So even if you can't come along, you can join virtually and listen into some of the sessions. The focus is what it says on the box in some ways. It's looking at SNOMED use within Europe. So it's not really about SNOMED international talking, although we do have a couple of sessions, but it's more about hearing feedback from countries that are using SNOMED, individual clinicians that are using SNOMED, where it fits into some of the European projects coming up. So it's something which I think you will find useful and interesting. And most importantly, it's free. So you can just log on, register, access, it doesn't cost you anything. Some educational materials, particularly around or aimed at clinicians, of which the link is on the page. I'm not going to click on that. We also have a number of conference calls really driven by the community. So when specific topics come up that need a broader discussion, we look at getting some topic-based calls up and running. We haven't done many of late, not because we can't be bothered, but more because we haven't had the topics identified to actually drive them in some ways. The other thing that we keep, we're building up a clinical contact database. If you're working as a SNOMED author, one of the challenges is not just adding terms into SNOMED, but it's having the understanding of what those terms mean to enable you to model them correctly and place them correctly in the SNOMED database. So we keep basically an address book of clinicians who are willing to help us. If you're willing to help us, let me know and I'll add you to the database. So how do you get involved? If you want to join a clinical reference group, like I said, all the pages are open, so you can just go and have a look. You don't need to do anything. But if you want to actually participate and join in some of the discussions, like most blogs you get online, you can't do it anonymously. You need to be you. So you need a conference account. The link for that is on the screen in front of you. If you're joining, if you're joining a group, which that will come through anyway, there's also info@snomed.org that you can email with either joining a CRG or any other questions actually relating to clinical engagement or anything else for that matter, I guess. The directory of clinical groups I've put on here. So there's a single page on Confluence which gives you hyperlinks to all the groups. It goes on, the actual page goes below this, but I couldn't fit everything on, and you still see what was on the screen. But the links there, so just snomed.org/CRG. If you want to go in and have a look, click on it, look through some of the discussions, what the groups have been up to, you're more than welcome to do that. And I'm going to stop there. Sorry, dude. This is good.